How about you? What are your concerns in that space?
I think one of the ones in the mental health and neurological space in particular is whether technology is just going to exacerbate the problem that we already have, that we can get a bunch of fired up Silicon Valley enthusiasts to care about broader aspects of their health with a bunch of wearable devices stuck up their arm. What we can't get is the people that we actually need to contact most. Actually, this isn't just a mental health problem. It's we see this in a lot of chronic disease areas. But I think it's particularly difficult if we're, the biggest problem is the reason I went into industry was because I wanted to help the lives of people with disorders like schizophrenia, which is a terrible disorder to have, right? So people that are low income, can't hold down jobs, having a really crap life because of their disorder, how are crypto, blockchain, AI, blah, 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 how is that actually going to help their life? Because, and it does apply across all of us, I often think that I could do my job with a broken leg. Like, I'm not a professional football player, right? I could do my job with a broken leg, but I can't do my job if I get a mental condition that stops me being able to concentrate and focus. So the vast majority of people's jobs nowadays do depend on their mental health, depend on their brain health. But we don't think about it in anything like the same way that we think about our physical health.
I agree. And I think another concern that I have is, there's a lot of talk, and I believe passionately, about income inequality, for example. And the parallel that I see in digital health is digital health inequality. Yeah. So, right, who are the people that are going to be left behind when it comes to having the wearables, having the apps, having these solutions, these high-tech solutions when it comes to mental health? And are we missing the boat to a certain extent when it comes to the vast number of people that might not be served by this? And what are we doing as a community to really ensure that we're not creating a digital health inequality, right? Where you have the haves and haves not when it comes to access to these tools. And so that's a concern I have, because as an investor, it's hard to
it's hard to square that.
It's hard to square that side, right? It's a fundamental societal problem when it comes to this issue, and the question is, how do we as an investor ensure that those things are not getting lost, and that entire segment of the population isn't getting completely forgotten about.
Except that in all those tick boxes that you have that we were discussing earlier, IP, regulatory, if this is something, if ultimately someone's trying to solve a problem in a manner that could work in those populations, in those disadvantaged populations, then that's got to be the biggest possible tick in your box, because if it works in the disadvantaged population, it's almost certainly going to work in, across the spectrum. So I guess we're always going to have situations where we get the early adopters and so forth, but if we're looking for solutions that can work population-wide, they're going to be at least tolerable, say, so they don't depend on a particular gadget. They can be applied regardless.
They're agnostic to gadget. They're agnostic to necessarily...
And generational as well. I often think, how do I want to interact with my health? Ideally, I want it to be an app on my iPhone, because I interact with my iPhone all the time. It's the easiest thing for me. I wear a smartwatch. My niece would never wear a smartwatch because she's never worn a watch, right? Because the whole of her life that she's had to be anywhere on time, she's had a mobile phone. Her mobile phone has a clock on it, so she doesn't understand what a smartwatch would do. My grandmother would understand a smartwatch because she's worn a watch all her life. Right. So there's these kind of
generational divides.
There are generational divides and demographic divides, and I think the answer is, for all these software companies, is you have to be able to work across these
different platforms.
Platforms, and it's not just
it's
about...
a media to deliver your solution.
Exactly.
Right?
So it's not just about, does it work on Android as well as iPhone? It's like, does it work in a way...
In a 65-year-old plus
population. Can I deliver it on a tablet? Because my mum and my grandmother have tablets, and my... so...
I mean, I think that's a big piece of it, and I think, in my view, that the future is going to be as... I'm lazy, and I think a lot of the people are lazy when it comes to taking care of, their health.
Sure.
I like working out and things like that. But I guess my point is that the more passive we can make some of these tools where it's not like every day I'm asking my Alexa, hey, let's do a cognitive behavioral test to see how I'm doing today,
Sure.
right? I'm going to get bored of doing that every single day, and I'm gonna lose interest in doing that. And so I think as passive and as seamless as we can integrate it into what we're doing throughout the day, and finding ways to kind of measure our health in a passive way, as opposed to necessarily forcing people to take time out of their day to do this. I think, there's going to be some times where we are interested in doing that and taking care of our health and doing that. But I think as much as we can, make it a seamless effort where we can provide really actionable insights into patients and just the human population in general, without forcing them to, carry around all these gadgets and apps and wearables. And I think there's just going to be burnout.
It's got to be something that you can do while you're sitting on the metro or, waiting for your kettle to boil or whatever. I think for me, I think that time thing is really important. So I was having in my mind, do you have an electric toothbrush?
I do.
Right, so does it have a 2-minute beep? That,
it does, yeah.
Do you resent the 2 minutes? Do you get bored?
Yeah, right.
But 2 minutes seems to be kind of bearable. Like we commit 2 minutes of our morning to having okay teeth.
Yeah.
So 2 minutes is like the barrier in my mind that you might.
Yeah, the amount of time that people are willing to devote to doing something like this.